Do you need a heart catheterization? That would be poking a hole in an artery, feeding a catheter up into your heart, and shooting a dye in there. This is done in the bowels of a hospital with about 200 years of trained, educated people over the table looking at you. Very invasive, very expensive, and potentially dangerous. You can have an arrhythmia on the table. Oftentimes people do arrest on the table and they're resuscitated at that point in time. But it is a very valuable study because it allows us to determine whether or not you are at risk for having a heart attack. This is the kind of situation where you might end up with a stent placed, where we find using that dye and looking to see if there is a filling defect in that vessel, whether or not you might want to have a stent placed in order to keep that vessel open to continue to deliver blood to the heart. That's really one of our best management strategies for preventing heart attacks in people if there is one vessel disease. If there's multiple vessel disease, then you stop that procedure. You go in for a coronary artery bypass grafting, which is cutting through your sternum, exposing the heart, going in and bypassing the vessels that are blocked using the veins from your legs or the other arteries from your chest. An extremely invasive procedure. Again, triggered by a heart catheterization for evaluation. Heart catheterization, extremely invasive procedure. So we have a new technology that can oftentimes replace that evaluation done with cardiac catheterization. This test is called a Cleerly, and it uses new AI technology to evaluate the plaque that you have to determine whether or not that plaque could rupture, leading to a blood clot formation in a vessel and cause an event like a stroke or a heart attack. This technology is based in AI algorithms that can evaluate the existing plaque as to whether or not it is going to be prone to rupture. And of course, rupture causes the formation of a clot in the blockage of the artery, or whether or not that plaque may be stable and not rupture over time. So it's going to help us determine who needs these invasive cardiac catheterization procedures, and going forward, who might need what's called a revascularization procedure, like a coronary artery bypass graft or stent placement. So these are extremely expensive, invasive, and risky procedures. Going into it knowing exactly where you need to be and who actually needs the procedure is very important. So this technology becomes, for me, a game changer. As a primary care physician out into the community, now I have the ability to really determine who needs these invasive procedures, who is at risk, and who's going to benefit from them. The technology behind it Cleerly starts with a CT angiogram. So that does require putting an IV in somebody, shooting a dye into their veins, and then under normal CAT scan circumstances, which I think many of us have had, where they're just doing multiple hundreds of x-rays. This has been done for a long time, and some of you all may be familiar with a CT calcium score. And it's a similar procedure without the dye piece, but it does allow you very thin slices with the CT scan to determine whether or not you have calcium built up in the arteries that feed your heart. We know that there's plaque because the body will put calcium into that plaque in order to stabilize it so it doesn't rupture. So we have the body understanding there's plaque, want to stabilize this so it doesn't rupture, don't get a blood clot. You know, everything it can do to keep you alive that much longer, that's its job. So it is aware of this, and putting calcium in those plaques is the first step in stabilizing those plaques. That was a good test that we have called the CT calcium score. And if you have a positive calcium score, we know that your body is accumulating plaque in the arteries that feed your heart or potentially the arteries that feed your brain. So we're going to intervene at that point. And that might be the time that you get put on a statin or have lifestyle and dietary modifications to try to improve your cholesterol so they can prevent less cholesterol from moving into your vessels. And this has been the paradigm in medicine for the last 50 years. With this newer technology called the Cleerly, we have the ability to determine whether or not the plaque that is in your arteries is prone to rupture. So this is a game changer because, again, ruptured plaque are the ones that cause events. So with the Cleerly technology applied across a CT angiogram, we can actually evaluate your individual plaque and determine its risk for rupture. And that makes a big difference in terms of what interventions we might choose after that point or how invasive those interventions become. So Cleerly technology is new, but it has been very well validated. We are one of the few centers in the city who currently offer Cleerly technology, and I think it can make a huge difference in terms of how you manage your cholesterol, how you manage heart disease, and going forward, whether or not you are truly at risk for heart disease whether you should be on a statin. So a crucial test for us, and I recommend almost everybody get it clearly done, especially if you're over the age of 50, if you have any concerns about heart disease. And that would be having a family history, being told your cholesterol might be high, or any other reason that would suggest that you may have a heart issue. I think a Cleerly is a great place to start.